Positional release treatment to the lower leg, looking at gastrocnemius and soleus. Now, depending on how you have the knee will slightly vary the target. So you can see here I have the knee in full extension. That would be more locating towards gastrocnemius. You could treat soleus like this, but you'd have to press quite hard, and sometimes you may actually bruise and slightly traumatize the gastrocnemius. So for soleus, all we do is we add a little bit of flexion to the knee, and that will relax gastrocnemius a bit more as it crosses over the posterior aspect of the knee, and this will allow you, as you can see, to palpate quite firmly, but with gastrocnemius relaxed, it's a lot easier for the patient. So the technique is very similar depending whether you're treating gastrocnemius or soleus. So what we'll do here is we will press in, as this was found on examination and palpation to be the discomfort area for the patient. We would gauge, and you can see I'm supporting my fingers here, you would gauge through the depth of what the patient's pain scale level is. Once you have found that, we now need to find the position of ease. That can be done by adding a bit more flexion to the knee or a bit more extension. We can add some rotation to the lower leg, like so, just avoid too much compression on the Achilles. And we could actually add some plantar and dorsiflexion and some inversion and eversion of the foot to find that position of ease. Now, you may end up in a slightly more extreme position like this. Once you've found that that's the position of ease, the patient will be held here for around 90 seconds to 2 minutes once that area relaxes. And again, the palpation pressure can be slightly removed, but just keep your hand over that area. Once the time has elapsed, you will move the patient slowly back, one movement at a time, to the neutral or resting position. Allow a bit of time to go through once they're relaxed. Then you will either move proximally to the hip and the knee in terms of your adding quality and quantity of movements, of muscle energy techniques, mobilizations, manipulations, or you will come to the foot and ankle and you can add some gentle mobilizations or some soft tissue release to the area. Now it has been desensitized. And that is positional release to gastrocnemius and soleus.